Now I'd like to introduce our next speaker, Dr. Youngesh Lamu ma'am. She did her MBBS from Lady Harding Medical College, Delhi. She received her post-graduation MD Pharmacology from Maulana Azad Medical College and now presently working as assistant professor at AIMS, Bilaspur. She has more than 10 international publications and national publications. She has also worked as co-investigator in multi-centric ICMR project, ICMR RUMC COVID-19 study for the assessment of prophylaxis for healthcare workers, a multi-centric cohort study assessing effectiveness and safety. She also organized GCP workshop at many colleges. She also worked as coordinator of the Adverse Drug Reaction Monitoring Center of NDMC, MC, and Hindu Rao Hospital under Pharmacovigilance Program of India. She is also a member of the committee for formulating SOP for Ethics Committee, Biomedical and Health Research, and SOP for Ethics Committee Clinical Trial at AIMS Glasgow. She has keen interest in pharmacovigilance, clinical trials, and artificial intelligence in healthcare. She will be speaking about patient recruitment and retention strategies, inclusion exclusion criteria, effective patient communication. Over to you, ma'am.
So good afternoon, everyone, and thank you for that kind introduction. I'm Dr. Yangshan, and I'll be talking about patient recruitment and retention strategies. Now, the thing is that once we have done this randomization and we have incorporated patients into the clinical trial, it is very important that the patient needs to be recruited and retained during the clinical trial, because even though a study may be very well designed and well funded, it cannot bring a drug to a market without the availability of suitable subjects. So therefore, it is very essential that the suitable subjects need to be retained and recruited in a clinical trial. So the patient recruitment and retention in clinical trial is recognized as the key bottleneck in the drug development pipeline. And the process of this new drug development is extremely time consuming and expensive. So, and it takes up to almost 30% of the clinical timeline. So it is an issue that must be considered before and throughout the duration of the study. And it is seen that the participant recruitment difficulties leads to delay of anywhere between 1 to 6 months. And each day of this delay costs around 60,000 US dollars to 8 million for the pharmaceutical industry. So as you can see, there is a lot of money involved. So delay in recruiting patients will be very harmful for the clinical trial. The patient recruitment planning is very essential. The four most important steps in to follow in order to properly plan a recruitment is, first is to understanding of your audience, the patient that you're recruiting. You should know what is the demographic profile of the patient that you're including in your clinical trial. What are the available resources that you have in place, and learn the expectation of the sponsor. What does the sponsor want from this particular clinical trial? And finally, evaluate your final results. What worked in your favor and what did not. So the study feasibility is the first thing that should be in your mind. Once you understand the study population, you should identify those participants who are eligible, who may be eligible, and the incorporation of patients during initial process of clinical trial is very important, and understanding their apprehensions and ensuring that they understand their voluntariness in the clinical trial, their participation in the clinical trial, and subsequently obtaining informed consent for participation. Also conducting a thorough physical examination screening procedures as mentioned in the protocol, and enrolling the participants based upon the eligibility criteria. So doing this particular exercise at the beginning of the clinical trial is very essential, so that you do not have problems in future with the patient retention. Because once you recruited the patient, it is very common that the retention of patient is you will lose patient into follow-up. So therefore, as I said, the demographic profile of the patient is very important. That is the place of residence, the ethnicity, what the culture and the language that the patient speaks. So all your informed consent should be in vernacular languages also. The ethnicity and the race also is very important. So if suppose if you're doing a clinical trial in a northeastern state, so you that the site should have uh, participants or staff should be trained to consider, to be mm, sensitive to their ethnicity. And then the occupation that the suppose the patient is a daily wager. So if the daily wager comes to for a clinical trial, so he will have his own concerns whether including in the clinical trial he will lose out on the money that he will earn during that day. So that is also important. What time of the whether you're obstructing his occupation or not. The gender in the sense in Indian scenario, it is very important, because the women in India, they are not the decision makers. So the most of the decision is taken by the spouse. So that gender and the religion and education factors, it is seen that the more educated a trial patient is, there is more level of comprehension and retention during the study. Whereas as compared to patients who are less educated, we lose them out to uh, in the clinical trial. Then the socioeconomic status, again, low socioeconomic status. So patient of low socioeconomic status, the primary concern of coming into a clinical trial is financial. But uh, financial incentive also can be, ascertained to only one level, because some of these patients have been enrolled in a BAB study where they understand the risk is very less, but they don't understand in a particular randomized control clinical trial the risks are much more. So sometimes they try to negotiate regarding the money. So that also should be very made clear at the beginning of the recruitment process itself. Now recruitment of the patient is also a very balancing act, because you have to ask whatever you're asking for research purpose should be justified in terms of the burden of disease. So suppose if the burden of disease, especially in pediatric age group also, if the burden of disease is very light and you're telling the patient that you have to visit the center multiple times, and you have to get yourself blood tests should be done every week or every 3 weeks. So if that is more, you're asking for research and the severity of disease is less, so most of the patients will withdraw. So there has to be a balancing act between the burden of the disease as well as what are you asking of, in terms of research. Then once you've understood your audience, then comes available resources. So what resources do you have at hand for conduct of clinical trial is, first of all, how will you go about recruiting the patient? So where is your data? So first you start with your internal database, and then it does not necessarily, you can do networking, you can start at low cost, you can start recruiting patient through your own network, reach out to physicians for referrals, community out you through various community outreach activities. So these are, less where you need less money, less capital. And also once you've recruited, contact the most qualified potential participant. So a very educated participant will further help you recruit more patients, because he's aware. Then site selection or an assessment. Once you the location of the patient care, also where the treatment decisions are made, all those selections should be made prior to recruitment, because uh, possibility of there could be a possibility of very interdisciplinary relationships. So whether it is feasible or not, because multicentric trials, some sites will have problems in interdisciplinary relationship. So one needs to assess the site. Has the site done similar trials before? How is their recruitment history? Are the facilities adequate? So site selection is one of the very important aspects of patient recruitment. And what about human resource? Do they have adequate human resource for the study? So that all these things are also very important. Then depending upon the site, you will have specific strategies to um, approach. And once you identify the problems in a particular site, then you will create various tools to identify, approach, and enroll and retain patients. And you can also anticipate if any problems that can arise in that particular site, and then quickly recognize what is the problem behind it. And also the recruitment schedule, if you're running behind schedule because of one particular problem, then you need to identify that particular problem and solve it, and go on with the schedule. We need to also make relevant patient relevant patient colleagues aware of the clinic. So most of the this clinical trials, if generally there is one method, is the spread of word of mouth. So if patient knows in the hospital setting, or your colleagues know that there is a clinical trial, this in hospital is a clinical trial site. So awareness of patient regarding the clinical trial being conducted in your hospital will also help in recruitment of patient. Then we need to understand the expectation of the sponsor. So you have to understand and tell the sponsor regarding your written plan. How are you going to recruit for that particular site? So you should have a well written document for recruitment. And the estimated budget also, you should give the sponsor at the beginning of the study itself that estimated budget that you need for recruitment of the patients. So recruitment of patients obviously will you will need a lot of capital. So that estimate how the number of the sample size that you're taking, how many patients, if you're sponsoring any travel expenses, if you're giving them any incentives, if you're getting all the investigations, how much what is the cost of that expenses. So all those needs to be calculated beforehand, and estimated budget needs to be given to the sponsor for recruitment. At the end, what you do is evaluate the results in the sense that when you have conducted a clinical trial, at the end you will see how many patients did I recruit and how many were retained. So what worked in my favor and why, and what didn't work in my favor and why. So you can this will be a learning experience for you for next clinical trial. So this will help you in the sense that recruitment of patient, what are the factors which are involved at your particular site, and what obstacle do you encounter, so that you can deal with that obstacle in future in a better way. So what is a good recruitment practice? So the 4 points were that we need to identify your audience, you need to assess your resources, you need to um, learn about the expectation of the sponsor, and at the end your analysis of your results. So these are the 4 strategies which you should plan your recruitment strategy. But what is good recruitment practices? How do you start recruiting patients? So there are multiple methods of recruiting patients, and the most first I will talk about is social media in current scenario. So in current scenario, social media is a big boon for uh, conducting clinical trials, in the sense that because a lot of patients are on social media. So you can have Facebook groups of clinical trials. Then you have WhatsApp groups. You can have Instagram. So all this social media has in recent times has facilitated patient recruitment in a large manner. Other than that, patient investigators own practice, the patient that are coming in investigators own hospital or the clinic or the site that have identified, That is also one. Then the medical records in the hospital will help you in patient recruitment. You can send me emails to what selected hospitals or the general practitioner clinics that we are recruiting patients for, this particular clinical trial. So kindly refer your patients. Then again, you can have brochures, flyers, and posters in OPD clinics. Then review of local or commercial patient panels, postcards to the referral networks, and you can print advertisements also through community television and in terms of newsletter. So, but what is the difficulty in recruitment process? The difficulty in recruitment process is that the recruitment strategies are rarely considered early enough. So once you have done your inclusion exclusion criteria, so inclusion exclusion criteria very narrowly defined. Patients are not involved during the process of in making those inclusion exclusion criteria. They're very narrowly defined. So recruitment again is a difficulty if you have a narrow inclusion exclusion criteria. And then the budget allocated for effective recruitment are inadequate. So once you're conducting recruitment, you realize that you need budget. So that again is a roadblock. Then enrollment deadlines are not realistic. So sometimes, logistically, if you see on paper and on ground, so the timelines are variable because the time required for, you can have certain geographical problems also in multicentric trials, in the sense that the patients are not, the site is very far away from the patient's houses. So that also will lead to delay in the deadlines. And also investigator may lack a basic knowledge about recruiting patients. So they are not well trained, and investigator may assume that he will rely on his own database for recruitment, which may be inadequate. And the biggest of all is obviously all the patients will have this apprehension that clinical trials cause they have a lot of disadvantages, as in COVID also, as you can see these days, the Pfizer is people are against Pfizer, this the CEO of the Pfizer regarding the adverse effects of COVID vaccine. So there's a lot of negative publicity from the media regarding clinical trials. So that was, again, is a deterrent for patients to enroll in a clinical trial. So from a patient's perspective, it is seen, it was done in a European survey that out of found that 68% of the patients interviewed would consider joining a clinical trial, and nearly 2/3 of those responded were motivated to advance medical were motivated to advance medical science. So it is not there that patients, if they are well informed, they will obviously try to help and help medical science, and they have this notion that they can contribute to the medical science by enrolling in a clinical trial. So they help other patients, help each other with this condition. And then 48% thought that they will obtain better treatment for their own condition. Then 34% obtained, they thought that they will get faster access to treatment. So, however, a survey of around 6,000 people with cancer conducted in 2000 took a look at why so few adult participants were there in cancer clinical trial. So it was seen that 85% of the patients were unaware that participating in clinical trial was an option. So from a patient perspective, the unawareness regarding option of entering into a clinical trial is also a major deterrent. So what are the major problems from a patient's perspective? So unless you know your problems, you do not know how to deal with the solution or how to come up with a solution. So first is identifying what are the problems with the patient. So first is patients, there are misunderstanding. So generally this misconception is there that the clinical trial treatment would be less effective than the standard care. So the treatment that I'm taking is the best and no new drug can help me. And also the study protocol is not very clearly explained to the patient, and the patient might think that he might get a placebo. So the protocol or the design of the study is explained in such a way that patient gets confused. Secondly, I already mentioned there is lack of awareness about clinical trials. Third problem is the patient will think that he fear of becoming a guinea pig. So they would treat me as a guinea pig. So and any tests are being done on me without my information. So patient will think that I'm being used. Then fourth problem is that patient does not know how to enroll, whom to contact. There is not enough information out there uh, in general population, in general public, as in how to enroll into a clinical trial. And the fifth problem is individual. So individual skepticism and obstacles are there. So every patient will have their own individual obstacles, like there is a traveling distance. Suppose he needs to travel, so who will pay for the bus or the car that he's traveling? The timing should match. There is inconvenient timing during working hours. Then any socio-cultural issue, that there might be a taboo of going into hospital again and again. Then the biggest problem of all is the length of the study. So any patient, it is seen that who has been associated with the clinical trials, so the duration of the study has led to loss of patients. So longer the duration of the study, we lose patients. And finally, the fear of adverse effects. So obviously that is an apprehension that every patient will have. So you need to understand all these problems and then allay the anxiety of the patient. So why do patients join clinical trials and why do patients not join clinical trials? You should be aware of that. So why do patients join clinical trials? So patient there are people in the society who have altruistic bent of mind, and they want to help advance knowledge of disease in the interest of the society. Then obviously there are other things, like there are rare diseases in which patients, there is lack of availability of the therapy. uh, then patient might think I will get improved medical care, or maybe patient does not have any health insurance. On advice from a family physician, patient might join a clinical trial, and for financial reasons also patient might join a clinical trial. So what do subjects want? What is their expectation? What is the expectation from the staff once they're enrolled is that you need to engage them in the sense that you need to explain them in detail about the clinical trial. You need friendly individuals. You should inform them about their health, their medical condition, and what is the progress of the study. So all these components, if the patient are explained well, there is high chances that retention rates are high. This is what the subjects or the patients want. They should feel that they have somebody to contact if they have any concerns. Suppose he faces any adverse effect, so he should know whom to contact immediately, and where to write, where to connect. um, the results also should be sent to family physicians, because the family physicians are the ones on whom the patients trust the most. So trust is a major factor in retention of the patients. So if you involve the family physician also in the process, the patient will feel much safer. Patients should also be, now and then they should feel appreciated and know that their time and contribution is valued, and you can give thank you notes or birthday cards or newsletters, and sometimes on telephonically also you can tell them that we appreciate your support. And uh, lastly, if you can provide them with transportation, that is also a big help for them, because that will, you know, that will, this is one of the hurdles that patients face, because they think that transportation, going to the clinical site and spending so much money for transportation, so that out of their own pocket. So if you provide transportation, so that will also be what patient expects. So what is so this was recruitment, and so the strategy for retention is, the basic idea of retention is that you should treat the patient with respect. You should be considerate of the patient's time. identifying and overcoming barriers to retention in a timely manner. So you should respect patient's time, the time that he's giving in the clinical trial, and any obstacle that the patient is facing, you should be prompt in solving that. So patient retention, as I already mentioned, you ensure feedback is provided sensitively and quickly, ensure any payment that you have to, any compensation that you have to pay to the patient is processed swiftly. The transportation, identify patients who need transportation assistance so that they don't cancel the appointment. Then by investigation at the first sign of possible study withdrawal, if you see any lack of interest or any study withdrawal, the you have to identify at the beginning itself so that you can address that. Then explaining the diagnosis and the medical procedure and clinical trial in a very friendly and accessible tone will help put patients at ease and increase both recruitment and retention. Also informing that patient that their contribution is significant to the trial and make them feel appreciated by the PI. This goes a long way in patient retention. So patient who, it is seen that patient who feel very active and autonomous in their health management, who think that, I know that I'm taking this drug, this is my progress of the of disease, these are the results of this clinical trial, who is aware. So there are chances that the patient retention is more. So how more you can improve retention is currently, as I told, social media. Use social media. You can have Facebook groups. In those Facebook groups, the patient can write their queries. So immediately you can address those. Then for appointments, you can have WhatsApp reminders, and then reminder calls, automated generated phone calls for reminder follow-up visits. Then in between, thank you notes and birthday cards. So these are just giving a personal touch to the patient, because they feel appreciated or they feel somebody is concerned about them because they're giving their time to this particular clinical trial. Also giving trial specific supplies like glucometer for patient in an anti-diabetic trial, or a mosquito net for a malaria prevention trial. So these are small things, but they will help motivate the patient to remain in the trial. So it has been seen that this really helped, these small gestures really helped patient retention. So this is just a summary of what we already discussed. There should be proper communication. So communication is the key here between patient and the principal investigator or the staff there. The reminder visits, compliance reminder, texting, phone call reminders, any kind of educational support, in the sense that any kind of if there is complex procedure, you need to explain it to patients, so you should offer short tutorials to all the coordinators. The investigators conducting the trial also should be very clear about how the recruitment happens. Then treat clinical participants well, and attention is good for morale. So now in terms of Indian experience, so this is an experience of KEM Mumbai. So they are one of the sites for clinical trials, and the challenges that they faced in recruitment was, one of which was this. This is regarding healthy participant related issues. One of which was the age and the gender. So most of the healthy participants were in the active age group, reproductive age group. So therefore, they have to use acceptable methods of contraception. So, and even practice sexual abstinence in some cases. So this was a real challenge, especially among women. Then they also experienced that some of the patients came only for free medical checkups and lab investigations. So once they were done with it, the participants declined to, participate further. Many of the potential participants actually do not listen or even understand the risk of participation in the clinical trial. So they will initially they will participate for the financial reasons, and later on they will they will say that we were not told about the risk of participation. So patient participation related issues. One of that is gender. So what the woman or the I already told you, the woman, for women spouse or senior members was the decision maker, and less educated patients needed, this is particularly relevant to Indian scenario. So the less educated patients needed longer discussions. Daily wage earners refused participation in trials involving hospitalization due to fear of losing pay. Patient festival is a big thing in our country, so patient declined to enroll during festivals. And ICU care, the patient refused the fear of environment of phase 1 unit, which resembled an ICU. So these are the patient related issues that were uh, um, encountered in KEM. Then sponsor related issues, like the protocol had such stringent eligibility criteria that many volunteers were deemed unhealthy. So the hemoglobin range given to the given for recruitment was 13.5 to 18, which is, very stringent as in Indian scenario. So laboratory ranges also. So India is also one of the upcoming hubs for clinical trials. So the standard ranges mentioned in the multicentric studies are from central laboratories, which may be different from normal ranges at the study site. Any delay in the scheduling, conducting, receiving reports of DSMB meetings, so that those are all sponsor related issues. And slow disbursement of funds by the sponsor leads to delay in recruitment. So these are the solutions for recruitment and retention, which was suggested by this particular study by N. Chaudhary. So it is seen what is the primary challenge here is the trial design and stringent eligibility criteria. So what is the solution? You early sponsor, investigator, and other stakeholder meeting to draft a protocol which addresses the anticipated recruitment issues. So once you're at the initial stages of protocol writing, one should address those recruitment issues, and you can do pilot study in few sites and learn from that experience. Then declining site performance due to insufficient resources. So that again, sponsors will need to help at this particular site. The proper staff is there. They have give necessary equipments for conducting the clinical trial. So that is also a solution for recruitment. Then poor patient contact. So this poor patient contact means the patient is not aware, patient is not engaged. So that is very important for patient recruitment as well as retention. So therefore, all the engagements, WhatsApp groups are essential for this patient contact. So once you lose patient contact, then it is very difficult to retain the patient. So you should have, you should be in constant contact with the patient, so that the patient has constant reminders from your side, and so patient knows that you're concerned about his health. Then if the patient has some inconvenience or non-motivated site staff, so suppose your site staff is non-motivated, so you can give them incentive of co-authorship or gifts, so that they are, you can incentivize the site, or you can recognize site champions. You can, give them gifts so that they're more motivated for recruiting patients. Then this is a study by Chaudhary et al., which basically focuses on the patient-centric randomized clinical trial. So this is a concept in which they conducted a clinical trial it's a longitudinal randomized clinical trial in prostate cancer patients. And what they studied was this novel patient-centered recruitment retention model. So in this, what they focused on was the concepts of trust, attitude, communication, and expectations. So these are the four things that they focused on during patient recruitment, and they studied the effect of this model into what is the retention percentage. So this patient-centered randomized clinical trial also helps active engagement of all stakeholders, including patients, It also helps in sensitivity to the needs and challenges and appropriate use of available sources at study sites. So this is just one of the, you know, what is the strategy regarding this patient-centered values and strategies. So trust is one of the biggest factors in patient recruitment and retention. So if a physician is involved and the patient has complete trust over the physician, and this particular physician, he could be a general physician or family physician who has introduced the patient to the study. So involvement of that particular physician in the clinical trial, keeping him updated about that patient and up to date with the patient with study answer, help in retention. Then attitude of the staff that you have recruited for recruiting patients also has shown to have encourages the patient in a very altruistic manner. So positive attitude of clinicians, office staff, and research staff towards study helps in better patient recruitment. Then communication, obviously communication is the key here. Communication via brochures, via uh, telephone, via websites, or your social media. Constant communication is the key for patient recruitment as well as retention. So make phone calls between optimal hours. Contact via preferred method of communication. So if the patient prefers telephone, you can call him, or if he prefers email, you can email him. Then expectation of the patient. What does the patient expect during the study course? So patient expects that during the study course, he should know what is the progress of the study. So provide detailed and concise explanation of the study procedure, and engage all the stakeholders, advisory boards via regular meeting, and provide update on the studies. So send letters of the progress report. So now if that means if there is a physician involved, a family physician involved, or any family members involved, you should engage them also and tell them the progress of the study. So this will help, introduce compensatory incentives, provide gift cards at baseline, and follow up and completion to appreciate participation. So if you address all these 4 points, the trust, attitude, communication, expectation, so and this will help, this will go a long way in retaining your patients. So I'll end this talk by saying a quote by Abraham Lincoln. If I had 60 minutes to cut down a tree, I would spend 40 minutes sharpening the axe and 20 minutes cutting it down. So what the take home message here is: plan in advance, plan beforehand, gain trust of the patient, build a healthy relationship with the patient, communicate with the patient at every level, and know your patient's concerns and expectations. Thank you.
Thank you, ma'am, for such an insightful presentation. Now we shall take a couple of questions coming from our delegates for you, ma'am. Ma'am, the first question is, what is investigator own practice in good recruitment practice?
Investigator's own practice means, suppose the investigator has his own he's a medical practitioner and he has his own patients. So if he can motivate those patients for in recruiting, because the patient will already have trust towards that particular physician, so he can motivate those patients to enroll in clinical trials.
Okay, ma'am. Thank you, ma'am. And second question is, ma'am, how the balancing act role in ask to research versus burden disease, and burden of disease is light and ask of research is high. Please explain with example. What is understanding audience through social capital?
So balancing act means, so when basically the idea is risk benefit ratio. So obviously once a patient is getting involved in a clinical trial, he will obviously judge his risk benefit ratio, in the sense that how many visits shall I have, doctor, how frequently should I visit, what are the investigations that you're going to do. So if the patient thinks that my disease, or the study that is being conducted, the disease is not very severe, like It's not a rare disease, it's not malignancy. So the patient will prefer not to come that frequently. Like suppose in case of hypertension, so in hypertension patient will not would like to go for multiple follow-ups. Whereas if a patient of malignancy or cancer patient, the burden of disease is high, so patient will obviously will be more compliant towards the uh, ask for research. Means what are we asking for research? We are asking for multiple visits and multiple investigations, so patient will be more compliant versus a patient who has a little lifestyle diseases, so he will not be that compliant to come with that frequently.
Thank you, ma'am.
Okay.